Physicians ask about the adverse event profile of ibrutinib in comparison to other options for treatment of relapsed and refractory MZL. We do not have a direct comparison trial, and that would be the definitive answer to that. However, we can compare the results of the Pharmacyclics 1121 trial to other trials of either indolent lymphoma that included marginal zone lymphoma or trials that looked at follicular lymphoma patients alone. And what we see generally is that the adverse event profile seems favorable for ibrutinib. Specifically, the toxicities are typically grade 1 or 2. They are very rarely grade 3 or 4, and it's highly unusual that a patient would die on ibrutinib therapy of causes that are related to treatment. In addition, dose modification of ibrutinib allows patients to continue therapy even if they've had a grade 3 or 4 event. One of the important questions is whether atrial fibrillation and its risks secondary to ibrutinib are an important issue for the adverse event profile. The actual risk of atrial fibrillation is probably cumulative and in patients can occur later into the treatment as much as several months into therapy. Patients do have the option of continuing ibrutinib with correct and careful management of their atrial fibrillation. In fact, treatment paradigms have been published regarding the use of anticoagulants and the various forms of treatment for atrial fibrillation. Happily, a patient who is doing well on ibrutinib can therefore continue on ibrutinib with atrial fibrillation management. Another common question is, what is the adverse event profile regarding bleeding? Because of non-targeted effects in platelets, patients can develop bleeding. Most of the bleeding is quite superficial and manageable, typically light bruising, most commonly on the upper extremities, and with counseling, patients are comfortable with that. The more concerning profile is regarding severe adverse event bleeding. It's actually relatively rare with ibrutinib. We counsel patients regarding the risks of surgery to avoid any complication, and the FDA has included in the package labeling directions for simple and more complicated procedures. In addition, on the 1121 trial, we had only one person who had a severe event in terms of intracranial bleeding, and that patient had not taken the drug for a substantial number of days, so the bleeding was not related to ibrutinib. I've treated a lot of patients with marginal zone lymphoma over the years, and I'm happy to say that right now the patients are doing very well, and having a new treatment option for them that is not chemotherapy related has made an impact on a lot of patients' lives. And they really appreciate having a good quality of life with disease control that is convenient and Those patients really appreciate having a good quality of life concurrently with disease control so that they can lead normal lives.